So hello and welcome. Welcome to our webinar on advances in blood pressure research. My name's Fiona Ewing and I'm the Community Engagement and Events Officer at Menzies, and I'm your technical host for the evening. So we'll begin our presentations shortly, but I wanted to let you know how the evening will go. The Director of the Menzies Institute for Medical Research will begin by giving us a short outline of the work our organisation has been doing to support the COVID-19 response. She'll then introduce our three speakers who will speak for about 15 to 20 minutes each. There'll be a Q&A session at the end of the presentations. You can type in questions via the Q&A button, which is at the bottom of your screen. You can type them in at any time during the evening, but so we don't blow out our timeline, we will save your questions for the Q&A session until after the presentation. At the end of the evening, there'll be some contact information provided, as well as some links to blood pressure resources that you can download for yourselves. If you miss writing these down, don't worry, as we'll send you a follow-up email tomorrow with everything included. In that email, there'll also be a link to a very short survey we're asking you to complete to assist us to improve our delivery of these webinars. So for those of you who engage with Twitter, our communications manager will be live tweeting during the talk, and the Twitter handle is @ResearchMenzies. Or one word. Now it's over to the Director of the Menzies Institute for Medical Research, Distinguished Professor Alison Venn.
Thanks very much, Fiona, and great to see so many people who are on the call this evening. So my name's Alison Venn. I'm the Director of the Menzies Institute for Medical Research, and it's my job to really warmly welcome you to our public talk, presented for the first time as a webinar. And before I go any further, as a reflection of this institution's recognition of the deep history and culture of this island, the University of Tasmania wishes to acknowledge the Muwinina and Palawa people, the traditional owners and custodians of the land upon which we meet this evening. As a short introduction to Menzies and the work that we do, we'd just like to show you a short video that I think captures our intentions really well. So if our technology works, it will appear.
Please stand if you, someone you love, or someone you know has been affected by multiple sclerosis, dementia, arthritis, heart disease, or cancer.
Thanks. So I'm not sure how well that came through, but I hope you got the gist that we really focus on a range of conditions that are important in the Tasmanian community and that really affect so many people that all of us or someone we know in our families or our friends or our communities, these are conditions that affect many of us, and they're really important focus for our work. So today's public talk via webinar is a first for us. We appreciate it presents some challenges and isn't ideal for everyone, but we wanted to ensure that we could offer a public talk despite restrictions on gatherings, and we hope you enjoy it, and of course we will welcome your feedback. Like many others in Tasmania, at Menzies we've mostly been working from home, but we've also ensured that we continue to keep essential laboratory and clinic work going, albeit in different ways. Our researchers remain committed to their current research, supervising students, and responding to new demands directly related to the COVID-19 response. In some instances, this has meant engaging in new research projects. We've also contributed our expertise in advisory capacities, locally and nationally. And we've provided staff to the Department of Health to assist with data analysis and reporting in times of high need for extra resources. And while medical research is front of mind in relation to COVID-19, it's really crucial that we continue to focus on other aspects of our work. Today's focus on high blood pressure is a really great example of research at Menzies that is both locally, nationally, and internationally relevant. And I'm really pleased to introduce our three speakers this evening. They are Professor James Sharman, who is also Deputy Director of the Menzies Institute for Medical Research. Jim's Blood Pressure Research Group is working on a series of studies ranging from understanding the basic human physiology of blood pressure to exploring new methods for improving patients' diagnosis and care. He's collaborating very actively with cardiologists at the Royal Hobart Hospital and leading an international consortium to try and understand the factors contributing to high blood pressure measurement inaccuracies. We also have this evening Dr. Dean Vicconi. Dean is a postdoctoral research fellow at Menzies, and he works with the Blood Pressure Research Group. His PhD studies focused on the accurate measurement of blood pressure, and he's currently extending research in this area. We also have with us this evening Graeme Lynch, who is CEO of the Heart Foundation Tasmania. Graeme was first appointed to the Heart Foundation in Tasmania in 2008, and he has a background in hospitality, business and law. As part of his work with the Heart Foundation, Graeme currently chairs the Premier's Physical Activity Council, the Tasmanian Chronic Disease Prevention Alliance, and the Health in All Policies Collaboration. Graeme's also Deputy Chair of Primary Health Tasmania, and we're really grateful to Graeme for joining us for this presentation this evening. So with no further ado, I think I'll hand over to Jim, who will take us through the first part of the presentation. Thanks, Jim.
Great. Thanks so much, Alison. So welcome everyone, and thanks very much for dialing in this evening. It's really terrific. This is a bit of a shock for me, first slide seeing me like this. I'm going to quickly get off this and on to someone else, but to give you a quick overview of what we're planning on talking with you this evening. We want to convey some information, some latest research information, but also importantly connect you with some key resources that we've developed to help you measure your blood pressure, find out how to get an accurate blood pressure device, as well as many other resources. So today what I'll be doing two talks. Firstly, just introducing you to what is blood pressure and why is blood pressure so important, and also why it's important to measure accurately. And I'll be connecting you to the resources on how to measure your blood pressure at home. So, okay, this is not going forward. Advancing the slide there, Dean is going to talk to us about blood pressure device accuracy and the validation of blood pressure devices in Australia. Some very important recent research that I think will surprise you about the availability and the accuracy of blood pressure devices in Australia, and importantly connect you with some resources on how to check whether the blood pressure device that you have is accurate and has been appropriately validated, or if you're intending to buy one. And Graeme is going to talk about the role of the Heart Foundation and connect you with some important, they've got some terrific support and resources for people to help improve heart health. And of course, if you improve heart health, blood pressure comes along with that. So without it, what I would like to also stress, so while we have put all of this content together for you, we actually need your help, because we don't know to what extent how effective the materials are in terms of the needs, does it suit your needs, and whether we can do some things better. So we really welcome your feedback, your critical feedback, as well as your questions. You can do this via email or through the Q&A tab at the bottom of your screen. You can also contact Gudrun Wells on this email around specific feedback, not only on the information that we give you today, but also we're interested in understanding, we've got a large study looking to improve the way that cardiovascular disease is assessed in general practice in Tasmania. And there's a very large randomised controlled trial trying to improve that situation for people to get the highest quality blood pressure measures and the highest quality measures of cardiovascular risk. Once again, though, we need to understand, we're all researchers, we need to connect with the community that are actually going to be using this resource. So if you think you might be interested in being involved as a part of a community reference group, please let us know. And again, you can contact Gudrun on that email, and we'll show that email later on in the presentation. There's no obligation, of course. So I told you that I'm going to start by explaining what is blood pressure and why is it important. So what we have here is an animation that's supposed to represent a beating heart ejecting blood into the proximal aorta. So the aorta is the most compliant artery in our body, and it connects directly to the heart and enables blood to flow from the heart into the vascular system. So every time our heart beats, it generates, we've got flow to the periphery, but it generates pressure. And of representing that pressure pulse here, and this is actually a pressure pulse that was measured in an actual individual. So we can feel this pressure pulse if we think of any superficial artery, the carotid artery in our neck, or the wrist, the radial pulse, any superficial artery, we can feel that pressure pulse. And that's what we're trying to measure when we measure blood pressure. So every single time our heart beats, there's a generation of this pressure. So if we think about the role of our heart, it continues doing a magnificent job without us actually really having an awareness and of it beating away. And if we think about an average heartbeat at 70 beats per minute, in a 24-hour period, that's already somewhere in the order of 100,000 beats that generates pressure each and every time. And so throughout a month, we're now generating something like in the order of 2.8 million beats, an individual generation of pressure pulsations throughout the arterial system. In the course of a year, over 30 million individual beats. Over 5 years, you can see the numbers stack up. And if you think about it, over 75 years, the heart beats somewhere in the order of 2.5 billion times, which is quite incredible when you think about the work that it's doing day in, day out, without us really even knowing about it. So here's some pressure pulsations that were actually measured in people. And in this particular example here, we have the systolic pressure at the peak and the diastolic pressure at the trough of this pressure curve. An example here is someone with elevated blood pressure, 160 on 90. Same person, same heart rate, different person, different heart rate, same heart rate, I should say, but much lower blood pressure. And this really exemplifies the issue of high blood pressure. It doesn't necessarily have any symptoms. The heart beats away minute after minute, month, weeks and months and over years. And unless we measure our blood pressure accurately, we don't really get a sense of whether we've got raised blood pressure. And the underlying cause of most cardiovascular disease associated with high blood pressure is atherosclerosis. So this is the buildup of plaque within the arteries. And over time, with exposure to high blood pressure, you can get a little piece of that plaque breaking away, or a blood clot forming that actually blocks a downstream artery. And when that occurs in the heart, the vessels of the heart, that is a heart attack. In the vessels within the brain, that is a stroke. So this is the underlying cause of most cardiovascular disease, and it's the problem of high blood pressure. So we make every attempt to measure blood pressure accurately at an artery that is at a location that is closest to the heart, where we can inflate this cuff. So we do this around the upper arm, around the brachial artery, with an automated device. I'm going to take you through, just very quickly, some fast facts on high blood pressure that you may not know, because people kind of go, well, what's the big deal about blood pressure? How big and bad really is it? So this publication recently in the Journal of Clinical Hypertension. It's available publicly. It's a great fact sheet, and it gives you pretty much everything you need to know about high blood pressure. It's the world's leading preventable risk factor for death and disability on its own, because the world's leading cause of death is cardiovascular disease, and high blood pressure is the leading risk factor. But only about half of people with high blood pressure are aware of it, and this is because there are no symptoms, and unless you measure your blood pressure, you don't know you've got high blood pressure. And among those who actually know they have high blood pressure or they've had it measured, about half of those do not have their blood pressure controlled to a level that reduces risk. So a lot of people are exposed to increased risk of high blood pressure without even really knowing about it. And year in, year out, at the moment, it causes about a bit over 10 million deaths per year attributable directly to high blood pressure. It causes about more than half of all heart disease, heart attacks and heart failure and stroke. But let's have a look at the other side of the coin, the good news. We can lower blood pressure with either lifestyle, diet and exercise, or very effective medication to lower blood pressure reduces the risk for cardiovascular events, the heart attack, the stroke, the kidney disease, etc. Because the high blood pressure actually causes these problems. If we can lower it, then that reduces the risk. So that's the good news. It's fantastic news. And when we put all this information together, back in 2005, Professor Thomas Pickering made this statement that the accurate measurement of blood pressure is one of the most important tests in all of medicine. It's a big statement, but if you think about it as the largest risk factor on the planet, if we know that we can identify high blood pressure accurately, we can do something about it, clearly it's very important. Professor Pickering went on to say, but unfortunately it's still one of the most inaccurately measured tests. And that was in 2005. And still, sadly, in many ways, that is the same situation today in 2020, which is why we're reaching out to the community and putting you in touch with resources to try and help the accurate measurement of blood pressure. So how do we measure blood pressure accurately? So we can get a blood pressure measured by a doctor in the clinic. This is really only a screening tool, because I think what is well known about the white coat effect, that the measurement of blood pressure by the doctor themselves tends to elevate the blood pressure. So that's not ideal, and we know that that's an issue. So blood pressure in the clinic is a screening tool. The gold standard is 24-hour ambulatory blood pressure, where a person wears a monitor throughout the day and night while they're sleeping. Now, this gets an average of the overall blood pressure. But it uses expensive specialised equipment. There's no Medicare item number. It's not widely accessible. So not everyone can do this, and it's costly. So an alternative is home blood pressure, where people measure their own blood pressure at home. And this is widely recommended by blood pressure societies around the world. And this is what we're really concentrating on today. So home blood pressure really is widely used to diagnose and manage high blood pressure. It's much superior to the clinic blood pressure to determine whether you have high blood pressure, to determine your true underlying blood pressure. And it's a much stronger association with cardiovascular outcomes than clinic blood pressure. It involves measuring the blood pressure at the home under the direction of a healthcare using a very standardized approach here. Now, I'm going to take you through some of these resources later, but I'm going to throw to Dean now, because what we're going to talk about next is the blood pressure device to use when you measure your blood pressure at home. It's critically important that you get a blood pressure device that's accurate, that's been appropriately tested and determined to do the job. So Dean is now going to talk about what is blood pressure device validation around accuracy, and what is the state of play in terms of the accuracy of blood pressure devices in Australia. So I'm going to stop sharing my screen here and hand over to Dean.
Okay, thanks very much, Jim. I'll just put this on full screen. There we go. Okay, so I'm going to start by talking about what is blood pressure device validation. Uniformly around the world, hypertension societies recommend that the use of validated blood pressure devices. This is undisputed. So what do we mean by validation of blood pressure devices? It's when a blood pressure monitor is tested for accuracy. So we might have a new automatic blood pressure monitor and want to test it compared to manual measurements, which when a doctor or a nurse measures blood pressure with a stethoscope, measuring at the upper arm. It's important that testing of blood pressure monitors is independent of manufacturers because there may be conflicts of interest associated with that. And specific accuracy criteria must be met. And this is all covered in very detailed, internationally accepted scientific documents or protocols. And a monitor that meets the accuracy criteria is then said to be validated. So it's been tested and it meets those accuracy criteria. So that's what I mean when I'm referring to validation or validated blood pressure monitor. But there's a big but. Most blood pressure monitors available for sale are not properly validated for accuracy. Why is this a problem? Well, this study examined home blood pressure monitors from patients. They determined if the monitors were validated first and then took some measurements to see how accurate they were. And they found that for validated monitors, 68% of the monitors were accurate. However, if a monitor was not validated, then only 15% of the measurements were accurate. So older monitors, irrespective of validation, are also more likely to be inaccurate. And a good guide to this is approximately, if a device is approximately over 5 years old, it's worth having tested to see if it is still accurate. So what are the accuracy of devices that are available in Australia? So this was the focus of our recent study. So in this study, we aim to evaluate the number, the type, percentage, validated, and the cost of home blood pressure devices available online in Australia. And I need to acknowledge Rawadi Deshpande, who was an undergraduate research opportunities program student with our group, who did a lot of the work on this study along with the rest of the team. So what did we do? We first did a Google search to identify businesses that were selling blood pressure devices to Australians. So this was an exhaustive search, and we looked at businesses that either were Australian or shipped their stock or shipped their blood pressure monitors to Australia. And we identified 4 types of businesses. So pharmacies, medical businesses which sold healthcare related goods but are not defined as pharmacies, general retailers, so these are department or electronic stores. They have online presences but also conventional shop fronts, so you can go into the store and purchase a device. And also e-commerce businesses. So these businesses didn't fulfill the above criteria, and they only have an online presence. So I'll take you through what we found now. We identified 972 unique blood pressure devices available for purchase in Australia. Now, 278 of these were the conventional upper arm cuff devices that I'm sure a lot of you are familiar with. And we found that 51% of these, or around 18%, were proven accurate according to international validation standards. We also identified 162 wrist cuff devices. So these devices function by inflating around the wrist instead of the upper arm. And only 13 or 8% of those devices were validated. The thing that surprised us most in this study was that we identified 532 unique wristband wearable devices. So these are otherwise known as activity tracking devices that are worn around the wrist. They don't inflate when they attempt to measure blood pressure, and all of these purported to measure blood pressure in one way or another. And crucially, none of those devices had been proven accurate according to international validation standards, which is a major concern. So across the different types of businesses, we found varying levels of percentage of devices that were sold by these businesses that were validated for accuracy. So you can see here between 24% for pharmacies and up to 47% in the medical businesses were validated. However, crucially, when we look at the e-commerce businesses, so these might be organisations like Amazon and eBay, only 5% of the devices that we saw or we identified were validated for accuracy. So you can see there's wide variation in the level of validation across different businesses, which makes it challenging for us to recommend a business to purchase blood pressure devices from. But what we're doing is we are working with pharmacies now to try and improve this situation so we can get this number up to hopefully 100%. When we look at different types of manufacturers, these three here are all commonly quite popular or common manufacturers of blood pressure devices, and you can see that they had varying percentages of validation of their devices that were available in Australia. The fourth company here, Lot Fancy, is a popular company on eBay and Amazon, and you can see that none of their blood pressure devices were validated for accuracy. Now, this data is also similar to an online registry, which I'll show you in a moment as part of our resources. We also found that validated devices were more expensive. So you can see that the costs here. And so we can perhaps speculate, although we didn't measure this, that people could be more drawn to lower priced devices, but these are less likely to be accurate, which is a problem. So what about how do we actually identify a validated blood pressure monitor? There's really lots of questions on how we might go about this. But I've got a solution. You can look no further because Dr. Trust here will save the day. And this is actually a #1 bestseller on Amazon in India, so not Australia. But it's not validated. So this is clearly a highly selling device, but it's not validated for accuracy. What about Australia? Well, this is currently the #2 bestseller on Amazon Australia for blood pressure monitors, and it's also not validated. So just to sum up really quickly, we must use a validated blood pressure monitor when we measure blood pressure. It's very difficult to know if a monitor is validated based on where it is purchased, the manufacturer or the brand. It's important also to note that at the point of sale, there's rarely information available about validation status, which also creates an additional challenge. And I just want to reiterate that non-validated devices are more likely to be inaccurate, which is just reiterating the importance of identifying a validated blood pressure monitor and using it. So for the last couple of minutes of my part of this webinar, I'm going to talk about the resources we've created. So this is the current Menzies webpage, you can click on this link here and it'll take you to the resource, but I believe that'll also be provided in an email tomorrow, a direct link. So what we've done is we've put together this resource. It does go for 3 pages. So the first page is a general introduction to why we need to use accurate blood pressure monitors, and it lists a number of country-specific and also general online free registries which provide listings of validated blood pressure devices that you can search to check if a monitor that you might be looking to buy or that you already own is validated for accuracy. And this document has been endorsed by national and international organisations. So the last 2 pages of the document feature step-by-step guides on the 2 general registries which are intended for worldwide use. And I'm not going to go into the details of these, but when you, or if you do download this document, all the links within this document are live, so you can click them and it will take you directly to these registries, and then you can follow the steps to check your blood pressure monitor. I've just put this slide here with the link, but Fiona's also going to have those details later. You can also take a photo of this QR code. But for now, I won't leave that up for too long so that we can keep this webinar moving, but those details will be provided later for you. So now I'd like to hand over to Graeme Lynch, CEO of the Heart Foundation. So I'm going to stop sharing my screen now.
Right, thanks, Dean. Let's hope that I'm as proficient as you and Jim in getting my screen up. Can everybody see that? We're all right with that? So, look, good evening, everybody, and it's great to be here with my colleagues from the University of Tasmania, but the Menzies Institute for Medical Research. And I must say that Alison and Jim and Dean have all worked very closely with the Heart Foundation. When I was looking at this first slide, and it says that the Heart Foundation was established 61 years ago, and in 1959, a huge public health problem had really come to an end, and that was the issue of communicable diseases and pandemics. And the Heart Foundation really came into being to work on the growing rate of chronic disease, and particularly people dying of heart attacks. And where are we in 2020? We're dealing with a communicable pandemic. But the Heart Foundation is the largest funder of research, of cardiovascular research in Australia, apart from the Commonwealth Government. And over the last 3 years, we've committed about $50 million to research. Each year we process about 500 applications for funding, and you would be interested to know, we've been wondering about what the impact of COVID would be having on the economy broadly and on the research community. But this year we've received about 15% more applications than we have over the last couple of years. So it certainly shows that the research community and the research industry is certainly busy at this time. Importantly, with our research program, we independently review every application for research, and that might be in clinical research, like we're talking about tonight with blood pressure. It might be biomedical research, as we're talking about, for example, with COVID-19 and viruses. And it might be general population health research, which is a very important subject here in Tasmania, and the Menzies Institute has a very strong population health research base, which is terrific to deal with our issues in Tasmania. Each year we fund approximately 70 new projects, and at any one time we're managing about 200 funding agreements. This is just, it's a busy slide, but it just shows the main research grants that we fund in Australia. As you can see, the biggest one is the Future Leadership Fellow, and fortunately in Tasmania we have 2 future leaders working out of Menzies that are funded on those 4-year programs. There's a whole range of activities the Heart Foundation funds, and we're really keen to fill that gap between really experienced large group researchers and those sort of mid-career and emerging researchers, and that's where we focus our activity in terms of funding research. And we also have an alumni program, which we hope brings together researchers right across the country. So effective researchers always achieves the best outcomes through collaboration, and we're seeing that from what Dean's presented in terms of the blood pressure validation, where it's a worldwide effort, which fantastically is being led by Jim and Dean here in Tasmania as part of the Lancet Commission on Blood Pressure Validation. But the Heart Foundation certainly likes to act as, and can act as, a connector of researchers from institutions all around Australia and of course overseas. Just a few statistics in Tasmania. We've funded 13 research projects in Tasmania over the past 8 years. A number of them have been at that really high end, which means that researchers primarily from Menzies are very competitive when you look at our per capita results in terms of winning these competitive grants against much larger institutions in other parts of Australia. And 9 researchers have been involved in those 13 projects. Across Australia, just in terms of blood pressure alone, which is the subject of tonight, we've funded over 8 million in 46 blood pressure research related projects in the last 8 years. So that sort of highlights the importance of blood pressure and the role it plays in heart disease. And as a result of that, there have been a huge number of publications, 150, leveraging of another 31 million for that 8 million investment, which is very important. And again, the Menzies Institute for Medical Research is very successful in collaborating with other research groups to get larger pools of funds to really make a difference. And there've been over 100 invitations to present at various conferences on blood pressure alone. Jim talked a little bit about blood pressure. We just recently did a survey. The Heart Foundation is constantly surveying the Australian community on a whole range of issues. And during the COVID period, we actually asked people what they would do. This is a survey of 3,500 Australians, what they would do to reduce their risk of heart disease. And interestingly, only 1% suggested that they would look at managing and understanding their blood pressure. So we do have a long way to go. Jim mentioned that high blood pressure is a major contributor to heart disease and stroke, and it actually accounts for nearly 6% of the burden of disease in Australia. The other interesting thing, just for a local flavour, about 16% of the Tasmanian population actually has high blood pressure. And when you adjust that for age, because we have a higher age population, it's nearly a third higher, the prevalence of blood pressure, high blood pressure in Tasmania than it is for the Australian average. We don't really understand why, but certainly it's great that we are doing so much good research in blood pressure here in Tasmania to really understand that and to help our Tasmanian community. I just thought I'd focus just for a minute on the risk factors around what can result in high blood pressure. And the Heart Foundation is obviously very active in the world of the prevention and providing resources and tools to assist people in living the best life that they can and to be free of heart disease and stroke. So the sorts of things that are modifiable, sodium, and there's a direct link between salt intake and high blood pressure. So food and nutrition is very important to look at how much salt is in the food, added salts in the food that we consume. Overweight or obesity is the perennial problem for all of us in the public health space in Australia and around the world as to how we actually get on top of the overweight and obesity that feeds into not just heart disease, but all chronic conditions. Physical inactivity is a major risk factor for heart disease and stroke and high blood pressure. Alcohol will elevate blood pressure, and also sleep apnea, which can often be related to some of those other risk factors. And then, of course, there are those things we just can't do anything about, which are there on the right-hand side of the page. Sorry, I skipped forward one there. Jim mentioned that high blood pressure is a major risk factor for, or cause, in fact, of stroke and heart attack, but also it is relevant to those other conditions like vision loss, kidney disease, heart failure, which is a major issue here in Tasmania with our older population and a huge burden on the acute sector system here in Tasmania. We need to look at better ways of managing people who are suffering from heart failure in our communities in primary health care, and can also impact on sexual dysfunction. So there's something there for everybody to try and avoid high blood pressure and get their blood pressure well under control. Jim's touched on blood pressure readings, so I won't talk about that. And similarly, Dean's talked about the various methods of measuring blood pressure, and we can certainly talk some more about that in the Q&A section when that comes up. Similarly to Menzies, the Heart Foundation produces many resources around all things related to cardiovascular disease, and There is a guide on checking blood pressure at home, and that draws heavily on the research that I referred to earlier in this presentation that the Heart Foundation has funded, but also taking research from around the world. And this resource is very similar to the one that Dean's pointed you to in his presentation. We've also developed a blood pressure action plan that is easily accessible from the Heart Foundation website. So all you need to do is go onto Google Heart Foundation. It will take you to the website, and it's a very intuitive website that we've just recently relaunched and made it far more intuitive and far more contemporary in its usability and feel. So I encourage you to have a look at those resources along with the ones that you'll be provided from the Menzies Institute of Medical Research. But most importantly, on the Heart Foundation website, there are a lot of resources and tools and tips to support living a healthier lifestyle. So under our current strategy, we are very focused on improving food and nutrition for Australians and providing advice around healthy eating, what constitutes a healthy diet to enable you to reduce your blood pressure and to manage risk factors for cardiovascular disease. We also do a lot of work around active living, physical activity, creating environments that built environments that actually make easy and healthy choices easy choices and encourage Tasmanians to keep moving. And we're also doing a lot of work with a project that Jim mentioned around how we better assess risk factors for cardiovascular disease in primary health care. And this is done by encouraging people in Tasmania to go and see their GP and ask for an absolute cardiovascular risk assessment. And a very important part of that risk assessment is an accurate reading of blood pressure. We were successful early last year in our 60th year in getting an MBS provider number for GPs to undertake this absolute cardiovascular risk assessment. And as Jim mentioned briefly, here in Tasmania, he's heading up a large research project about how we might collect that data through pathology labs and present results back to general practitioners as a decision-making tool to remove some of the barriers to have these assessments undertaken. The final thing that I would recommend to you is that the Heart Foundation has a helpline that's open 5 days a week during business hours. So it's a free call to the helpline, and that number is 131112. That's 131112. And if you ring that number, that's manned by clinicians, mainly practice nurses, who are able to answer questions about all of the sorts of things that may concern you, whether it's about blood pressure, whether it's about managing cholesterol, whether it's managing specific conditions, but also importantly about lifestyle factors. If you go to travel and you have a heart condition, how do you organise insurance? How do you deal with mental health issues and so on? So there's a plethora of resources that we're constantly updating and that are available. And so I would encourage people on this call to go to the Heart Foundation website for information that will complement what you can achieve through the resources the Menzies Institute of Medical Research is also providing. So I'll pass back to, is it to you, Jim?
It is, Graeme. Thank you very much. That's terrific. So I'm going to, okay, I think you need to stop sharing your screen. Graeme, if you could do that.
Yeah, just a sec. I was having this trouble in our trial, wasn't I?
And that's fine now. I think we're good now. So thanks so much, Graeme. That's terrific. And I can just endorse those resources available for the Heart Foundation are really terrific. A lot of effort has gone into providing just the world's best evidence-based information in and around improving heart health, not just blood pressure. So thank you very much for that, Graeme. I'm going to try and advance this slide now. Last time it went very slowly, and it doesn't appear to be advancing at the moment. I'm going to stop the share, try again. Sorry, bear with me, please. I'll I'll try this one and go down to where we start again. And it works. So thank you very much, Graeme. And what I'm going to do to finish off on this talk, just quickly attend to some more resources, to connect you with some more resources around measuring and managing your own blood pressure from home. So we wrote this conversation article very recently. It was published just only a bit over a month ago, and it contains pretty much all the information that we're presenting you today. And all the links, all the resources are within this particular document. So I'm just going to finish off now about when and how to take home blood pressure very quickly. But thanks so much, Dean, about what blood pressure devices to use. Can you believe in Australia, 972 unique individual different blood pressure monitors, of which very few of them are appropriately validated for accuracy. And that's something we really are doing a lot to try and address and change that situation. So we also, within that conversation article, connects you to this resource, which is about how to measure your blood pressure at home. It's a publication we put together a few years ago now, but this is all about, again, connecting people to the best evidence base about what to do around measuring blood pressure. So if I just quickly take you through that now, it's really critically important when you measure your blood pressure at home, it needs to be using a standardized approach. It's no good if every time we go and measure blood pressure, we do something slightly differently, because our blood pressure is going to be different on the basis of the conditions that they've been measured under. So being measured in a standardized fashion is extremely important. So recording your blood pressure with a home blood pressure diary, again in a standardized fashion, not on a scrap of paper alongside your list of things to do, in a very standardized fashion, the morning and evening, the 2 readings of blood pressure. And in those resources with the links that are provided within this webinar, you can either have the downloaded paper version of this or an electronic version where you can enter your blood pressure readings. It automatically averages your blood pressure and you can send that to your doctor. But this is a sort of, although I mentioned at the start, we've developed these resources, we're not really sure just how well they've been taken up and used and whether we can do better in and around the way that we've presented this information. I note that there are some comments coming in, some questions. That's fantastic. Please keep them coming. There's no such thing as a silly question. We'll do our best to answer all of them at the end of this. So in terms of what blood pressure device to use, Dean's taken us through how to get access to that validated automatic device, preferably with storage memory, so that we can go back and see and we don't forget to write down the blood pressure values. And preferably actually purchase your own blood pressure device. In Australia, a validated device costs on average, as Dean mentioned, about $100. It's actually a really terrific investment. If you do have private health coverage, some providers do actually give you a rebate to purchase a blood pressure device, which is handy. But did you know you can actually hire or loan machines from pharmacies and from some general practice clinics at a very reasonable, $1.50 a day, plus a deposit that you get back if you return the machine, of course. Very importantly, you've got to make sure that the cuff that you have around your upper arm actually fits your arm within the accepted range on the cuff itself. If you have a cuff that's too small, it's going to overestimate the true blood pressure. And if the cuff's too large, it's going to underestimate the true blood pressure. So the point is, make sure that you get a cuff, an appropriate size cuff. Use an upper arm cuff, as we've mentioned here today, and as alluded by Dean, generally avoid the wrist cuffs and definitely the finger blood pressure monitors. They're usually less likely to be validated, and the further away you get from the heart, the less accurate those blood pressure devices are. and the less likely they've been appropriately tested for accuracy. So when is the best time to take your home blood pressure? If you're doing this at home, take the same time in the morning and evening. So after you've gotten up in the morning, after you've been to the toilet, and before taking medication, food, or vigorous exercise, because all these things can change your blood pressure. And again, we want to measure blood pressure in a standardized way. Take your blood pressure over a 7-day period, a 5-day minimum period. We don't have to go any further than this because the average of those readings over 7 days gives us a good indication of the true underlying blood pressure. And take your blood pressure as advised by your doctor. So this usually is just in that 7-day period before visiting the doctor, or if you've had a medication change, if there's been an increase or a decrease in your medication, just over 7 days, repeat your measures and then take them to your doctor. So in terms of the standardized approach to measuring blood pressure, it's really important to sit quietly, find a quiet place in your house, set yourself up away from talking, distractions such as TV, and make sure there's no extreme temperatures, particularly at this time of year. A little bit colder, that will increase your blood pressure. And likewise, if you're particularly warm, that'll affect your blood pressure as well. Sit in this standardized fashion here with your feet flat on the floor, your back supported. The cuff should be, your arm should be supported with the cuff level at the heart level. And after a period of quiet rest, then take 2 measures, 1 minute apart, and record those measures in the diary, either the paper diary or on the electronic spreadsheet, and then take the copy of that diary along to your doctor's appointment. So if you do smoke, I mean, one of the best things you can do to improve your heart health is to give up smoking altogether. But if you do smoke, it does acutely elevate your blood pressure. So don't smoke or drink caffeine within 30 minutes of measuring blood pressure. And if you can give up smoking, that's one of the best things you can do for heart health. So likewise though, what will put your blood pressure up is if you're in any discomfort, stress or pain, that will increase your blood pressure. So don't measure your blood pressure in and around if you're feeling that way. Wait until you can actually be calm, relaxed and feel comfortable to measure your blood pressure. Record your blood pressure. The systolic blood pressure is the larger number and the diastolic blood pressure is the lower number. And then take those readings to your doctor on paper or email a spreadsheet. And the reason why this doctor here is smiling is because she's incredibly happy that you've measured your blood pressure according to recommendations in a standardized fashion, and she can have great confidence that these readings do represent your true underlying blood pressure and that she can advise accordingly. So that is the end of my slides very quickly, and it leaves us a good deal of time to answer questions. I just want to reiterate the component of really asking for your assistance. We've done our best to put together these resources, but it's always going to be better if we can connect with the people that are going to be using it, find out how we can do better. And if you want to be involved in that community reference group, please let us know. Anytime, doesn't have to be this evening. When you receive that email tomorrow, you can let us know and we'll get in contact with you. Gudrun Wells's email is there and you can contact her. I'm going to stop the share screen now, and I'm going to go over to the chat, and we've got a few questions here. I think I might open them up and maybe have a bit of a go at answering some of these, and if others want to contribute to answering these questions, please let us know. So the first one that I think maybe people can't see here is actually from Vince. He's asked, what is the error rate between validated and non-validated devices? It's a good question. That it's actually, there's no standardized error rate of a validated versus non-validated device. What we can tell you is that on average, a validated blood pressure device, a device that has undergone that rigorous, internationally approved process of testing the accuracy, is more likely to be accurate in most people that use the device. If you have a non-validated device, the scatter in the error of both systolic and diastolic blood pressure is larger. We can't say with any certainty as to whether it may underestimate or overestimate in an individual, but on average, there is an underestimation of blood pressure in non-validated blood pressure devices. I think that's fair to say. I'm not sure, Dean, if you want to add anything further to that. Nodding, nothing further to add?
Just to add that there's been another recent paper in the last week or two which confirms all this other research, which is exactly what Jim said. Validated devices much more likely to be accurate.
Yeah. Thanks, Dean. And now Sandra asks, can you take your machine somewhere to be validated? I think, so when we talk about validation, we're talking about a device being tested in a very rigorous fashion amongst a group of people. So 85 people of different ages, different blood pressures, both men and women, and a very rigorous and strict protocol that it's very specialized. It's undertaken outside the manufacturers. It's not something that you can take your device to get validated, so to speak. But I think what you might be talking about is calibration. Can you take your blood pressure device somewhere to determine if it's accurate? Step number one is to follow Dean's advice in terms of checking to see whether that blood pressure device has been already undergone that appropriate validation process. Step number two, and this is a bit trickier as to how you go about this, but you can have it checked to see whether that device works for you, is accurate for you, by comparing to mercury sphygmomanometry, and that usually is in the setting of a doctor's surgery or a specialist blood pressure clinic where they can take many repeat measures using a mercury column where the person is listening with a stethoscope and determine whether your device is accurate for you. But it's quite a specialised process. It's not something that's widely available, I have to say. I'm not sure if, Dean, that's something that, or if please just add if I've missed anything there. We've got a question from Becky. What about high diastolic blood pressure when systolic blood pressure is in the normal range? I've heard diastolic blood pressure is a precursor to high systolic blood pressure. So what you're talking about there, Becky, is isolated diastolic hypertension. It's actually not incredibly common. It's when the lower number, the diastolic blood pressure, is raised. And yet your systolic blood pressure is under that threshold of 140. In the main, the most significant risk factor is the systolic blood pressure. That's where the greater risk is in terms of cardiovascular disease and stroke. But I'm not sure about a high diastolic pressure being a precursor to raise systolic pressure. I haven't heard of that before. But in the main, the principal blood pressure that relates to worse outcomes, if you like, is the high systolic blood pressure value. And now, over time, your diastolic blood pressure and your systolic blood pressure, as you get older, your diastolic blood pressure tends to drop a little bit. Your systolic blood pressure, on average, tends to rise a bit with time. The drop in the systolic blood pressure it widens the overall pulse pressure, which is the difference between the two blood pressure values. And if you have very high pulse pressure, so every time your heart beats, it's exposed to a very large difference in pressure. That also is a risk factor as we get a bit older. I hope that's answered your question. And Sandra tells me, whoops, I meant calibrated instead of validated. So we answered that question for you. Thanks very much. Okay, I'm going to move over to the Q&As. We've got 7 of them there now. That's terrific. I think some of them are quite technical here. I'm going to just come back to this one on the mean arterial pressure question. Prudence asks, what is the best way to measure blood pressure accurately in someone with white coat syndrome who also has a very low pain threshold? I'm guessing what this means is with the cuff around the upper arm gets quite uncomfortable, particularly if you have high blood pressure, the cuff wants to keep inflating higher and higher and higher to get that systolic blood pressure and understand what that is. there isn't really any other way except the best way is to try and get your blood pressure measured outside of that clinical environment that's causing the nervousness, if that is the case, that's causing your blood pressure to go up, that's causing that white coat effect. And this is where home blood pressure is a really good alternative. Some doctors use what's called automated unobserved blood pressure, and this is where they have a device that will take several readings over time, but they're not present. So they'll press the button, walk out, and they're not going to be there to elevate your anxiety and elevate your blood pressure, and therefore there's not that constriction around your arms quite so hard. And that should be, I think, those alternatives there hopefully is helpful for you. I would recommend monitoring your blood pressure at home if you're worried about white coat, hypertension. I'm going to pause to see if any one of the other panelists want to make any other comments. Linda asks, does taking my unvalidated blood pressure machine into my GP, did we answer that? Make it validated? We did.
Slightly different question.
Okay.
It's a similar answer that you were referring to before.
Yeah. So no, an unvalidated blood pressure machine is an unvalidated blood pressure machine. Unfortunately, we can't change that. And what about the wearable devices for blood pressure measurement? Are these monitors validated? Are you talking about those wristband wearables? I can tell you they are not validated. If that's the device you're talking about, Dean presented there are over 530 of these devices available in Australia online. They purport to measure your blood pressure, but in fact, not one single one of them has ever been properly assessed for accuracy. So no, we would recommend to avoid purchasing those devices if you want them to understand what your blood pressure is, if you're going to then use those values to take to your doctor and for your doctor to make decisions around medication and what your blood pressure control is. So try and avoid those. Go for the upper arm blood pressure devices that have actually been validated. Researchers are trying to develop mobile applications to measure blood pressure. How can we validate it? It's monitor for better accuracy. You're talking about mobile iPhone devices? If that's the case, I may have misinterpreted this. There are techniques to measure blood pressure with your finger on an iPhone, if that's what you're talking about. Again, this is wonderful new technology, but it's very much in the research phase, and we haven't seen any of these devices being adequately validated. But maybe that's something to watch for the future. Are the readings from non-validated devices generally consistent in their readings, always reading low or readings more erratic? It's a really difficult question to answer. I think from the data we've looked at, it's probably erratic is probably a better term. And it's really hard to say anything in particular, because the whole point about non-validated devices is that they're not getting an accurate picture of the blood pressure. Your blood pressure is changing anyway. So the extent to which it is a systematic error is very, very difficult to understand. Could regulators provide a seal of approval for validated devices so a consumer can know at the time of purchase? Why are all devices not validated before going to market? Excellent question. This is actually quite a complicated area, because in fact, many of the devices that are available on the market have been approved by the Therapeutic Goods Administration in Australia and in other places around the world, the FDA. They approve these devices for sale, for marketing and sale, but they haven't been adequately tested for accuracy. The focus is on safety. You know, is the machine going to set fire to your house or completely squeeze your arm off? That's what they're more interested in, and not the accuracy component. So they're approved for sale, and you can purchase them, but they haven't undergone that rigorous accuracy according to international standards that's expected. So that's the difference there. Dean, would you like to, the seal of approval? This is something I think we're working on. And these validated device listings that Dean's resource that he's mentioned, that will put you in contact with, if you like, a surrogate seal. It's basically saying these devices have been tested and we think that they're appropriate for use, but we don't have an overarching body that says, here's our seal of approval. We're working on that. And the World Health Organization is interested in this problem. A whole lot of key organizations around the world are interested in this problem, and we're working towards something of the order of what you describe. What about low blood pressure? Kat asks, apart from making sure you don't stand up too quickly and therefore temporarily feeling lightheaded, I assume there is no real medical issue with this. You're absolutely right. Low blood pressure is good blood pressure, but if you're getting regular symptoms and you're fainting, then that is obviously a potential problem. But if, as I alluded to in my talk, you know, your heart rate keeps generating your blood pressure, you don't have any symptoms or signs related to blood pressure, then low blood pressure is good blood pressure. Are there any other panelists that would like to handle any of these other questions instead of me just hogging the floor, Dean or Graeme?
I think it's interesting, Jim, the question around some consumer protection around, as you alluded to, around validation and consumers knowing that blood pressure devices are safe. I mean, there's always the fallback to it's the GP that's going to prescribe medications and so on, but there is this great feeling in the community, like a false security, that if my blood pressure is low, then I won't worry about going and talking to my GP and have that clinical intervention. So I think there's a lot of work that you're involved in, and that the Heart Foundation and others around the world really need to look at this closely and advocate for some sort of validation that enables consumers to feel safe, but also medical practitioners who are suggesting people do go home and have their blood pressure monitored at home. So I think that's an item that really needs some attention over the coming years.
And of course, Graeme, what you allude to there is that the risk for cardiovascular disease is not just wholly focused on blood pressure, although it's very important. We really need to consider the overall risk in the setting of other well-known risk factors, and that's where a heart health check, as advocated by the Heart Foundation, is really very important.
Yeah, precisely. Yep.
So, I can tackle a couple of these if you want, Jim.
Yeah, please go ahead.
So, can blood pressure be measured by PPG or photoplethysmography? I think there's a lot of interesting research in this space, but one of the critical things is these measurements typically need to be calibrated or scaled to a standard blood pressure cuff. So they're interesting because you might be able to measure blood pressure continuously over a long period of time, but a lot of the research so far has shown that these PPG measurements will drift over time after the initial calibration with the cuff method. So as far as I'm aware, none of those have been validated yet. Do low batteries impact negatively on readings? Should you use a continuous power supply for your blood pressure machine? I'm not aware of any evidence that suggests that having low battery power would impact negatively on the accuracy. I'm not sure if James wants to comment.
I think if your battery power is too low for to run the function of the device, the motor, what is it that I'm striving for? The pump. If you've got such low battery power that it won't run the pump, then it won't work. But it doesn't affect the validation of the device, to my knowledge.
And
yeah, here's one, Dean. So, if I paid over $100 for an Omron, is it validated? That's $100 question.
Yeah, and I guess we would, irrespective of the price of any device, any company, we would suggest that you do follow the resource that will provide the links to check if the monitor is validated. Whilst we saw a difference and that validated devices were more expensive, there is still overlap between those prices. So some devices were very expensive, but they were not validated.
Yeah. So the answer is no, we can't go by price. And, you know, there are $179 Omron devices that are not validated, and there are $100 Omron devices that are validated. So it gets very confusing. So we need to look independent of price.
We've got two very similar questions. Do validated monitors go out of calibration over time, or the lifespan of a purchased monitor? So I think some important things to highlight are that generally after research, some recent research has shown that after about 5 years, depending on the extent of use of a device, they tend to start to drift in their accuracy. So 5 years is a fairly good rough guide for a lifespan of a monitor. But it's also not necessarily just the internals of the monitor. If your cuff, for example, is damaged, or the tubing, any aspect of the device becomes damaged, then there is a risk that it may be less accurate than when you first bought it.
So we can get leaks in the tubing over time. They can erode, and that's the sort of thing that needs the monitor replacement, and it will be less accurate. We have a question here about when do you recommend that patients take their blood pressure before or after antihypertensives of the morning, or they just need to note this in their diary for the GP? The recommendation is to take the blood pressure before the medication. The reason for that is that a very short period of time after taking your medication, your blood pressure will drop significantly. But if you're taking your blood pressure in the morning, you want to know if you've got that antihypertensive effect overnight. So you want to be clear of that, taking that medication. Depending on the medication that you're using, it may be taking effect very rapidly. So within an hour, you might have the maximal plasma effects so that to lower your blood pressure. So we've got a question from Kay about your work in telehealth tech support and being made aware of an error in an A&D device, the MAP calculation using a standard formula with 1/3, 2 times diastolic blood pressure. This has been reported back to the manufacturer, but they have not been forthcoming with resolution. What's the best approach to rectifying this? Probably need to know a few more details. This is, I guess, for others, it's a bit of a technical question, but the mean arterial pressure, the MAP, is what these oscillometric devices are pretty much seeking to measure. It's critically important that they try and get that right, because then once they've got the mean arterial pressure, they then estimate the systolic and the diastolic pressure. So if there are errors there, then that might be contributing to errors elsewhere. I wouldn't know what to advise in the absence of a little bit more information around the technicalities of the problem. I'm sorry. So I think we've also answered that last question there about the high diastolic blood pressure when systolic's in the normal range. And have we got any other chat questions? Okay. So from Neve, you said that after 5 years, devices may not be accurate. How do we regularly check for accuracy? Dean, would you like to answer Neve on that one?
So I guess one of the best way, at our institute, for example, we have someone come in and check all our devices every year, but that's not really feasible for individuals at home. Perhaps one of the best ways you could do it is take it to your doctor and get them to check it against their manual measurement to see if it's still giving measurements that are very similar to those manual blood pressure measurements. And also, I guess, like we were saying earlier, really making sure you check it for wear and tear to the cuff, to the tubing, all these things that might lead to less accurate readings. I don't know if you want to add anything, James.
No, that sounds great, Dean. Thank you. I think we're running very close to time now, but maybe we can just attend to Mona's question. This might be the last one. What's the best exercise to reduce blood pressure? There is no, I don't think we can put our hand on our heart and say there is one single exercise that's the best, but aerobic exercise, regular aerobic exercise, even walking. We know that this will positively influence not only your blood pressure, but your overall cardiovascular health. There's a terrific, very large study in over 400,000 people out of Taiwan that showed that even 15 minutes of walking each day will improve your longevity, your chances of living longer, having less heart disease, and dying of anything. So regular aerobic exercise worked into your lifestyle as best you can will positively improve your blood pressure and your cardiovascular health.
I think, Vince, if there was a medicine that replicated what Jim has just said, that every Tasmanian should take it, because physical inactivity is a major contributor, not just to heart disease and high blood pressure, but to a whole range of chronic conditions. So we certainly at the Heart Foundation encourage you to get out and be active. If you want some socialisation, you can go to the Heart Foundation website and join a Heart Foundation walking group. There are many of them located all around Tasmania, so certainly encourage people to do that. And certainly what Jim says, half an hour of physical activity is all that's needed, and that can be broken up into 3 10-minute doses. So certainly encourage all Tasmanians to be out and be physically active.
Thanks, Graeme. Maybe just very quickly, Vince, yes, blood pressure varies during the night. It should go down overnight, ideally, should dip. And really the only way we can determine that is by measuring it several times during the night. So that's where our ambulatory monitoring comes in. So it's not a specific time that we could recommend. It's several measures while you're asleep. And salt, sometimes described as bad, other times not so bad. Salt is needed for life, like so many other things, but only in relatively small amounts. And there are salt embedded in much of our diet that we don't even know about, that elevates to levels that are unhealthy. So we do need to make sure that we don't consume too much salt. I'm going to be in Fiona's hands now as to when we wrap this up, as to whether we need to do that, and whether we answer these questions offline later. Are we at time?
Well, there's just that one more statement.
Okay.
Yep. Okay. And then I'll pop up the final slide.
Okay.
While you answer that.
Becky, thanks for this question. The last question this evening, throwing it out there. I've done the UTAS MOOC on dementia. Well done. I hope you enjoyed it. It's a really great resource. High blood pressure is also a risk factor for dementia, and that is absolutely right. So if we can lower our blood pressure over time, we lower our risk of cognitive decline, including risk for dementia. So, what we're talking about tonight has ramifications beyond just heart health, it's overall health. And thanks for throwing it out there for us, Becky, as you've suggested. So I think this is now the final slide from Fiona. We have contact information of Gudrun Wells there, further information about the Consumer Reference Group. You've got that QR code there for more resources that Dean's put together. Please give us feedback. It's a real pleasure for us to share this information with you, but we really do welcome all feedback. And if you want to sign up to the quarterly Menzies Bulletin, please use that email there. But otherwise, I'll just finish by thanking Fiona. Thank you to Alison for introducing. Dean and Graeme for contributing to the panel. It's greatly appreciated, and for all the people attending this evening and for staying this late. Thank you so much. It's been a great pleasure, and I hope to see you again. Thank you very much.
Thanks, Jim. Thanks, Graeme and Dean, and everyone for participating. Thank you. Good night.
Good night.